Hi, I'm Dr. Marty Ross. In today's video, I describe how to diagnose Babesia. Testing isn't reliable, so we have to make the diagnosis based on symptoms. If you have questions after you watch the video and need more information, click on a link that I have to a written article I have on this topic. It's in the description for this video. Treat Lyme is supported by purchases you make through Marty Ross MD supplements.
Hello, Nancy. Let's see. I believe I may have Babesia and I'm wondering how this would be diagnosed. Is it a clinical diagnosis or are there accurate definitive tests? If so, which labs, which type of tests would you recommend? Okay. So, Nancy, I don't like testing for Babesia. And I believe it is primarily a clinical diagnosis, okay? So, having said that, let me just talk to you briefly about Babesia. So we estimate that there are 15 to 20 strains of Babesia. And we have good testing for 2 different strains. That's about it. And that testing would look at antibody levels against something called Babesia microti, and there's another one called Babesia decani. And we have good antibody testing against those, but we don't have good antibody testing against the other 15 or 20 total strains, okay? Now, the testing for the antibodies can be done through IGeneX. IGeneX also has a microscope exam called a FISH test, and FISH test means fluorescent in situ hybridization. Basically, it's a way of tagging Babesia with a fluorescing agent so we can see it under the microscope. Now, presumably, that should be able to see many different strains. However, you need to have a lot of it in you to actually be picked up with the FISH test. So even the FISH test is not the most accurate way of testing for Babesia. So to be honest with you, I don't test for it. I don't take a person's resources to go ahead and test for this. I actually make my decisions to treat for Babesia based on the clinical signs, okay? Now, those clinical signs, or symptoms, I should say, I'll just kind of read them off to you here. These are the ones I look for. One is a person that has excessive nighttime sweating. That's one symptom we consider, and I'm talking about the kind of sweats that actually can soak the bed. People with Babesia might have panic attacks, which are severe anxiety attacks. They might have air hunger, so they get feeling a sense they can't get enough air in very frequently. They might have skipping or racing of the heart. They often will have headaches in the front of their heads and or migraine headaches. And they might also have very regular sensations of deja vu. Okay, so deja vu experiences very frequently. So everyone, deja vu is the sense that you've been there before. When something happens, it's like, oh, I've been there before, okay? So I usually consider whether a person has a number or of those, or if they have the 2 hallmark symptoms, I would say, are more the nighttime sweats or the panic attacks. So if they have those too, all right? So those are the things I would look at considering. Again, I usually don't go for the testing.